Welcome to Wellness Academy Audio.
Hey everyone, this is Chris Riedel from Wellness Academy Audio. We're doing something a little different today. We're going to be doing a Q&A with Dr. Byron Jasper. He's the owner and founder of the Bija Clinic. Just a reminder that the Wellness Academy Audio information is meant for information purposes only and isn't meant to be personalized medical advice. So thank you for tuning in, and let's get to the episode. Hey Doc, how you doing today?
Doing fine, brother. How are you?
I'm doing well. You excited for the holidays at all?
I'm going to say excited that 2025 is coming to an end and big things are coming in 26. Nothing in my mind specifically, but in my mind, I'm also going to manifest it. So yes, I'm excited for the holidays to get to the next year.
Do you ever do any end of the year planning for like New Year's or prepping for the next year?
I will say from a business standpoint and a goal standpoint, yes, it's not anything. I know some of these people are on like social media and they're like, oh, well, we take a trip and we spend 5 days doing it. I don't do all that, but I definitely will like get a pen and paper out or open up the laptop and kind of jot some things down on what I hope to achieve in the next quarter, next year, stuff like that. So not as egregious as some of the things where I have, my tripod and my social media following watching me plan my goals. But yes, I do a little bit of goal planning in some way.
That reminds me, I've been watching, there's a funny guy on social media who always mimics like some of the famous social media accounts where they'll sit there and it's like one of my favorite ones is like a nurse sitting there like filming herself crying after they lose a patient, and he mimics what that would look like behind the scenes.
Absolutely.
Where it's like, hey, all right, grieving family, pause. Let me set up my tripod.
Exactly. That's exactly why some of the stuff people will gravitate towards and subscribe to. It's almost like, do you realize that this is not the way it really goes? Like, the fact that someone is having perfect lighting in some of these moments should tell you that it's not real. But, people like entertainment, and I get it. When you like entertainment, you're going to find ways to entertain yourself, in my opinion. And with that, I'm not surprised, the person who says, well, let me show you how to plan for your goals by recording myself planning my goals. As awkward as it sounds, some people are going to literally watch that and eat it up. And hey, I'm not mad at them. You found your hustle. Go ahead and do it. But I think mine is a little more private. Very much I'm going to do my thing whether you're watching or not. And then when the cameras happen to come on, it's no different than what I've been doing when there were no cameras around whatsoever.
Yeah, we at our office, we enjoy, like John and I will sit down and we'll meet with each department. We just set the yearly plan, and then we break up that yearly plan into quarterly goals. And we found that to be really, really helpful at kind of creating that cadence, because if you try to do all this stuff over the course of a year, if you don't break it up into small little bites, a lot of times it just doesn't get done. And we found that's setting that habit. But when it comes to like personal, I keep telling myself I'm going to do it from like a household standpoint and all this stuff, and it just doesn't happen.
Yeah, I think it's also, like you said, making it easier than what a lot of people think. Like, you don't have to plan it all at one time. Like you just said, you can if you really want to, but sometimes the low-hanging fruit is the stuff you need to plan, right? So if one of my goals, it sounds really cheesy, it's finding a bookkeeper for one of my businesses that is going to be reliable to where I don't have to always keep checking behind them, other than the idea of, hey, every once in a blue moon, let's sit down and have a meeting and go over stuff. So finding a reliable bookkeeper sounds very, very basic, right? Like, oh, that's not a real goal. But until you've been through a number of bookkeepers that are not necessarily most reliable, you actually will see how that can be a little bit more of a goal for some people than others. So that's why I said sometimes people make it harder than what it has to be, right? It doesn't have to be you got to run a marathon in 2020. Hey, that's a great goal. It may just be, hey, I want to run a mile, or hey, I want to walk a mile, and then you build from there. So you got to figure it out, my friend. I'm just over here just trying to get certain things done in a very achievable manner without overworking myself. That's all.
Yeah, I mean, having the goals be attainable, I think, is half the battle, because frequently we try setting too many goals. We set them too far in advance, and we try to accomplish too much. And I always find that sometimes I lose track in the goals if I don't meet it, being realistic with myself and taking things Like, all right, I wasn't able to hit that goal. Is that because it's one, not a good goal? Two, because that goal is too big. Do I need to break that goal up? And then tracking it. And if I don't meet that goal, why didn't we? So it's fun actually reviewing last year's goals and looking at our 1-year plan. Some of our first quarter, second quarter goals, clearly we didn't achieve. And I looked at them and it's because we actually ran the play on the field and we found out that it did not work. Like it wasn't the system that was most successful. I think one of them was utilizing an app to replace email. And all of a sudden, now the app was good because it has exercises and things like that. But what we ended up finding out was that there was like a 3% of people were actually using the apps. We're like, all right, we need to switch up this system. But you don't know if something's going to work or not until you try it out.
Until you try
and
it,
then you set it and then you track it. So we're going to dive into some of the questions that people had for us. Are you ready for this?
Always.
So the first question is, what's the single best habit someone can adopt for overall health or wellness?
I wouldn't say best, but I'd say one that I think gets missed very frequently is getting adequate rest and sleep. Something that happens a lot with a lot of patients are this badge of being tired, right? Like, I'm only going on 3 hours of sleep and I'm on my 4th cup of coffee. Like, I don't know who came up with that idea. Like, that's a great line to tell people. It actually is the opposite. It's almost like you're admitting that if something goes wrong, you were exhausted. So the idea of getting more rest is probably one of, if not the best, but I'm not going to say always because everybody's different. If you already have a good sleep routine, it could be something else. But the one that's probably, again, the low-hanging fruit, doesn't cost a lot, is getting more rest. And getting more rest doesn't always mean getting more sleep. It could be unplugging from the computer, unplugging from the stuff at work, unplugging from all of the drama that's going on in this part of your life, and basically resetting. And if you can do that, I think a lot of people are going to be pleasantly surprised at how well they start to feel. And if not well, how much better they feel, right? You may already be feeling pretty good, but then you start to notice that you have more energy, you have less irritability, you have more tolerance to be in these uncomfortable situations where they previously would make you so bothered that you couldn't last 5 minutes in them. You're better as a person, a husband, a father, a mother, a daughter, a sister, a sibling, because you are now more adequately rested and you have more reserve. More reserve now means you're going to be a better person in a lot of ways. And the phrase that you'll hear me say over and over, and I think we've said it even on the last episode that we did, you can't pour from an empty cup. So if you are exhausted and drained, what are you really giving to your patients or your family members or your loved ones when you have nothing in the tank? Probably a shell of yourself, which may seem like you're doing a good job of putting on that front, but you probably aren't. And more rest allows us to not have that song and dance. So getting more rest is probably going to be the easiest thing, the most cost-effective thing, and the most consistent thing someone can do that I think from a primary care standpoint, everyone can get behind, right? You don't have to argue with somebody about, well, this causes side effects and this one's too expensive. Getting more rest, I think, is pretty simple.
And that's a really good one. There was I don't remember the name of the guy, but there's one of those famous social media people who talks all about, he has his 5 billion supplement routine and all this stuff, but he was talking just about, once again, how important rest is. And his whole thing was like hacking your resting heart rate, making sure that your resting heart rate before bed, all of the concepts are there. It's making sure that you're not eating close to bedtime, allowing yourself to tune down, turning down the devices. Of course, nobody wants to hear that. Everyone wants to scroll before bed or at least watch a show. But it's true that rest also results in your body just being on fire. If you're not getting enough rest, then all of a sudden your nerves are actually more sensitized, which correlates with chronic pain. So it makes a huge difference. And I love that you mentioned the irritability side of it, because I think that a lot of times people don't realize that their day can actually go worse because you're not well rested. So all of a sudden you're irritable. Well, every single interaction now is heightened. So your emotional intelligence isn't as high. You're more irritable in most of your responses. And all of a sudden you're going to be just getting into arguments your entire day. And then guess what happens when you get in arguments all day? You're more tired at the end of the day. And you're just using caffeine or, of course, other habits to help make up for that, and it completely depletes you. So I really like that. If there's one habit, I think going for rest. Do you mind talking about a lot of the components that go into maximizing or optimizing sleep.
Yeah. So one of the things we talk about in the primary care space is sleep hygiene. And
Hmm.
the phrasing of sleep hygiene is stuff you already mentioned, but maybe a little more structured. So things that are consistent habits that you are either doing or avoiding that allow you to get better rest, right? So some of those habits are simple things that we probably already know, right? Not drinking so much liquid right before bedtime because more than likely it's going to wake you up in the middle of the night for you to have to go to the bathroom. And of course, going to the bathroom breaks your sleep pattern. So now we got to start all over and hope that we can get adequate rest. That's already an issue. So that's something that a lot of people may already know. Things that a lot of people don't know, you already mentioned once again, trying to avoid digital products in the bedroom as much as possible. So, yes, we're not saying you can't have your cell phone, but try not to have it right by the bed where it's going to light up and vibrate and wake you up every 5 seconds because people or emails are coming through and bothering your sleep. Also, if you're a person with the TV on and you feel like I got to have the TV on to go to bed, try not to do that because you never know when the TV is on, something comes on at a loud volume. It can, again, break your rest pattern. So now you're not sleeping as adequately as you would have in the past. And those are two simple examples in the sleep hygiene universe, if you will, right? Other things we'll tell people is the bed is for two things, sleep and sex. So if you're in the bed doing a bunch of other stuff, reading, eating, trying to, finish this on your tablet with this ebook, all of that sounds good in theory, but it could break your sleep pattern. And people tend to get confused when they get in the bed and they're now sitting upright trying to read, but then all of a sudden they want to lay down and feel like they're going to go to sleep in 20 seconds. Your body's still not sure what the pattern is, right? So if the body is not used to being in a certain position for rest, it gets confused. It's not going to shut down the way it should. So those types of things are all in the sleep hygiene universe. And by us talking to people about doing that, it really gives them better rest without, again, costing anything. It eliminates bad habits. It promotes good habits. And it gives people the opportunity to get more adequate sleep. I'll give two more that I think are good because sometimes people miss these. I always argue or joke with people, depending on the conversation. When did we stop having bedtimes? That is a question, Dr. Chris. I'm going to ask you. When did we stop having bedtimes? Because most people have an answer, but the answer is usually unique, and it's unique to our story. But I'm going to start with you. When did we stop having bedtimes?
Like we as in society or we as in me?
We as in adults.
Adults? I guess it probably depends on who your parents are, but my guess is probably college, high school, depending on parenting.
Yeah. So most people, it's around high school, right?
Yeah.
They got to junior high and the parents started letting people stay awake,
Yeah.
right? You go to bed when you're supposed to. Oh, I got to study. Okay, as long as you get some rest. And at that point, the pattern that we built up that really promotes healthier children gets broken. So the children, the adolescents, the infants, the toddlers, anything up until high school, they have a bedtime. It's 7 o'clock, time for bed. It's 7:30, time for bed. It's 8, time to bed. It's not 8, you look sleepy, let's think about it. You look tired, oh, we're going to give you, 2 more hours. Like, it really isn't a debate. It's 8 o'clock, it's time for bed. It's 7:30, it's time for bed. So as adults, we got away from that potentially as teenagers going into high school, and we just basically went completely to the other end of the spectrum. We stopped going to bed at an adequate time regularly, and we just wing it. And then that habit gets built into college, post grad, and then from there, potentially professional life. And now, because you don't have a bedtime, you're wondering why you're exhausted. Well, it's because you never sleep consistently. So one night you may sleep 6 hours, another night it's 4, another night it's 2, another night it's 8, another night it's 10, and you're all over the place. So sleep hygiene actually promotes adults getting bedtimes. Now, that doesn't mean it has to be a very early bedtime. It doesn't mean it has to be a late bed. It's picking a time that allows you to get adequate number of hours. And if you know you wake up late because your job requires you to get there later, you can possibly stay up later. But if you know you have to be to work extremely early, you probably want to go to bed earlier. And that is a huge thing in sleep hygiene that a lot of people miss. And I think adding that into the equation of no digital products where possible, turning the TV off, avoiding doing things in the bed other than sleep and sex, and then, of course, eliminating the drinking part. Yeah, that's tough, right? So all of those things are the ones that we are talking about within the primary care space in the right setting. And there are way more than those. But that's the ones that I think promotes really helpful, restful sleep to where people can then start to say, when I don't do this, I feel really bad. So I need to get back to that. Hey, I stayed up too late. I'm now exhausted. I know I need to get back to my regular sleep pattern.
Yeah, I like that you pointed out the bedtime thing because, I notice on my watch because I track my sleep that, like I get that immediate deep sleep. If I go to sleep, my bedtime is going to be around 10 o'clock. So, I have a little wiggle room till 10:15, but if I miss that window, like I miss some of the most of my deep sleep. So I just go straight into deep sleep, which Cassie's not a fan of course, because that means that I'm not great at waking up for any baby crying or anything like that between the times of, around 11 to like 2 or 3. And then my sleep kind of evens off. But if I go to sleep at 12 o'clock or 11:30, then I missed the majority of what I would get as deep sleep. But I think some of the stuff gets kind of complicated because a lot of the high schoolers, when that happens, a lot of the time, I notice talking to high schoolers that they've got events scheduled until 8:30 p.m. Even younger than that now. I mean, you find the Little League baseball and stuff like that. The parents aren't getting home until 8:30, 9 o'clock, and then they still have homework to do. You see this a lot, honestly, with almost all the athletes, but it's not just athletes. It's also kids doing math competitions. It's band. We're just filling these kids' times. And I think that also turns into a habit that kind of pervades through college where you have different populations because some kids are staying up late playing video games or things like that. But we are filling up these kids' days. I mean, when is a kid going to go to sleep if they're getting home at 8:30 and that's when they're going to study for a test?
And I think it's tricky. And that's why optimizing the sleep hygiene, where, hey, look, we know your bedtime is going to be very, very different because you are in so many activities and you're getting home later and you got to study. But it's then optimizing that when you get into the bedroom to go to sleep, the phone is off, right? Hey, look,
Yeah.
you got an hour and a half of worth studying because you got a test tomorrow. You're in the bed by this time because we got to get up at this time. And when you're in the bed, you can't play on the phone. Like it sounds like a almost really tough, almost military type parent, but it actually helps in the long run when the person's more refreshed and a better athlete, a better student, a better friend because they're more adequately rested, even as a child.
Yeah, it makes a huge difference too when you're in the grind of things too, right?
Hmm.
So, you probably know or you definitely know from med school or during the toughest times, residency, they throw you all off. But I remember chiropractic school, it turned into a test every single day, test or quiz, test or quiz. And so I noticed that I did well because I stuck to that routine. I was asleep by 9:30 every night and I would wake up, very early to study, either go to the gym or not, depending on the difficulty of the test. But I was studying just every day. I used my weekends to make sure of it. But instead of pulling those all-nighters, because what would happen with people that pulled all-nighters was they would fall behind. So they would pull the all-nighter, then they'd be exhausted, but there's another test the next day. So you couldn't ever catch up. And I remember when I was coaching the LSU rugby team too, I was getting just absolutely exhausted because I'd come home after practices at 9 o'clock, just wired with energy from coaching. And I would stay up a little too late and I would stay up till that 11:15. But of course I'm at the office around 6:30 in the morning. And I noticed that was negatively impacting me where it caused me to be more irritable, be more fatigued. And when I just sat there and was like, no, you have to go to sleep, even though you don't feel like you need to go to sleep, you have to go to sleep. Just go to bed at that 10:15, 10:30. And I noticed that all of a sudden, once I found that rhythm, the season actually got a lot more easy for me to be able to maintain, even though that was just a lot. But by sticking to that discipline, the moral of the story is by sticking to the discipline, even though you feel like you don't want to, or you feel like you need to stay up, or you feel like sticking just like I'm going to bed at this time each day is going to make a huge difference in overall wellness. So I think that kind of builds on it. So I guess we'll move on to the next question unless there's anything else you had to add on the sleep topic.
No, I think we covered it very well. And I think the other part that possibly will come up in future discussions, I'm sure if someone's listening to this, is how do you determine what is a good sleep, for lack of a better term, time frame, right? How many hours,
Yeah.
things of that nature. And that's a whole different discussion. Different people, different hours, different ages need different amounts. But ultimately, I know that's the next thing. But the first thing I think is just getting yourself ready to sleep. And when the sleeping is happening, making sure you're not interrupted. And if we can do that, I think the rest part will be a lot easier.
Well, let's talk about that though. So what are the total number? We can start with total because everybody's different, but for 80% of the population,
Yeah. I'd
What
say
are
it's
generally your recommendations?
Yeah, I'd say it's somewhere between 7 to 9 hours. That's pretty standard. Some people can get by with less than 7, 6 and some change. Some people need more than 9. And it's hard to really give people that understanding that some people need more rest depending on what's going on in their lives, in their bodies. But it's not unheard of. But if a person is, and my favorite, well, look, I didn't get enough rest yesterday, so I'm going to make up for it today by sleeping longer. It doesn't work like that. I wish it did. I think everybody would appreciate that if you slept less the day before and you slept longer the next day, it somehow balances. But the goal is to have consistency, just like going to the gym. The more consistent you are, if you miss a day, you're less likely to have a drop off from one day missed because you've consistently been going to the gym regularly. But if you're consistently not going to the gym, you're going to feel it a lot more if something happens. Same thing with sleep. If you're consistently sleeping the way you should for your 7 to 9 hours, you're going to probably have less of a drop off if you have one day where you don't get those 7 to 9 hours compared to someone who's not doing that at all and it happens more frequently. So I think that's a standard sweet spot. Of course, again, there's more variation depending on certain diagnoses and certain people and certain ages, but ultimately, I think 7 to 9 is a sweet spot.
Yeah, I would agree with that because like adolescents are going to need a little bit more. People as we get older need a little bit less depending on a lot of variables. Yeah, one thing I also thought was interesting to mention is that naps, there's actually a lot of research coming out in the sports performance world, but in the cognitive performance world about like taking a cat nap.
Mm-hmm.
And so you kind of think back to the French way, you got to take that siesta around 3 o'clock. So that is another option if somebody does have a situation where their hours just don't provide for the total number of sleep you want. Taking a nap during the day could actually, help with that.
Yeah,
So
I'm not against it. I'm not going to jump up and say everybody needs a nap. I'm sure there are people who will argue that point. But I think what happens even with the napping is it replaces the mind that you need to sleep the way you're supposed to. So, well, look, I'm going to just nap during the day. I can sleep less. And then you're also not getting quality rest. So it's just basically promoting bad habits. But if you fix the sleep at night and it's not enough and adding a nap makes you better, go ahead. But if you're not sleeping well at night and you're adding a nap because you think somehow it magically balances the scales, that's where I'm going to disagree.
yeah, no, that's a good point because another one I read a recent study that showed that you can technically, there is some benefit to like I think it was in Navy SEALs where if they loaded up on sleep prior to to basic training, that there were some benefits, but all of a sudden I think you're dead on that there's some benefits, but the problem is we use these things to rationalize, like you said, the overall, how many people are actually, they're like, oh, I'll catch up on sleep on the weekend. And then they don't, you know what I mean? And it's also not a perfect 1-to-1 ratio where you can be completely sleep deprived during the week and then get an hour extra sleep. Like they think the math is gonna, the math ain't math in here, So all of a sudden they
100%.
think they're going to catch up, but they're not catching up. So I think the answer is always consistency. And that's going to make the biggest difference on this stuff. So everybody's trying to hack some fundamental, or they're trying to hack their way to good health. But the reality is it's the boring stuff. Like we were talking about with Dr. John on the previous podcast, the boring stuff. It's the going to bed at the same time, but by doing the boring stuff consistently, you allow yourself the freedom to be able to do the interesting stuff and you want to.
Correct. 100%.
So let's go on to the next one. What do you wish every patient understood about navigating the healthcare system?
Well, I'll say healthcare in America specifically is that getting good quality care doesn't often mean you have to spend a lot. It's finding those people who are able to give you quality in a way that fits your budget. Some people have more means than others and are able to spend on certain things that other people may not, right? And as we talked about earlier, someone may have the ability to get a bunch of supplements and non-traditional treatments that may allow them to feel better, right? Hyperbarics, oxygen, things of that. What is it? What is the deprivation, sensory deprivation, chambers, things like that, that may not be accessible to people who are in a lower means category. But it doesn't mean that your health is going to be worse because you don't have all these fancy bells and whistles. So if you realize that accessing good quality health care, having good quality health is actually something that can be done by basically finding the right fit for you, right care person for you, you'll end up having really good, high quality care and a longer, happier, healthier life in a lot of ways. And I'll be very specific with that. So if a person says, I don't have the really big budget and I can't go see all these fancy doctors and nurses and get all this health care that I'd like to get, what can I do? Well, again, getting up, being consistent, doing movement, having a good diet, getting adequate rest, being around people who make you laugh, feel happy, and relax, all of that still makes you live longer than the average person who's not doing any of that. And you didn't have to spend any extra money on this fancy new therapy. So I think the biggest misconception is that you need a lot of fill in the blank to live longer in this country, at least. And I think you and I have basically seen different things or read different things where there are a bunch of countries that have less capital, less access to Western medicine and modern medicine, but they still live a lot longer than American people generally. And it's usually people who are in those spaces where they're constantly moving, constantly in social settings that make them happy, less stress, more rest, and everything goes along with that. So I think if we can get more people to understand that, then we'll have more people who are, again, living longer and being healthier and happier.
Yeah, I think there's the blue zones, and then there's the Tarahumara in Mexico, and a lot of it, as you said, it's the movement and the foods and the social. It's all the things that you mentioned to help avoid it. But I guess building on it, so from a medical standpoint, the most important things you mentioned, diet, exercise, rest, all that stuff is insanely important. But what are some of the big things from a preventative care standpoint that make a lot of the difference?
Yeah. Great question. I think one of the biggest things is getting into care before you're sick. In America, we're taught or made to think that care is accessible when you're sick. We're thinking about actually sick care rather than health care. So if we, on a prevention side, know that we can access care before we get sick and do that regularly, if not consistently, like we've talked about throughout the whole episode, we will end up having better outcomes. I use analogies all the time, not only in our radio show, but also in our practice, where we constantly try to tell people things in a way where it hopefully will stick with them. And one of the things I tell people is, if I said to you, Dr. Chris, I want you to go ahead and drive your nice new car and never, ever, ever take it to the mechanic until it starts having a problem. How long would you actually listen to me when it comes to anything in life if I give you that advice?
If you give me that advice
I
to
gave
just
you that
drive
advice.
it,
Just drive. Yeah, just drive it. I mean, it's fine. It'll tell you when it needs to have a problem fixed or looked into. Just drive.
well, I'd probably be mad as soon as something broke and I was on the middle of the road and stranded and I had to call AAA.
And you
But then I
possibly,
wouldn't have AAA because you would have told
you
that
don't need it.
within that logic, I wouldn't have AAA. So I'd just be out there and I'd have to, either I'd have to change the tire or whatever problem was
Yeah.
broken on the
Depend,
side of a road.
depends on what part of the country might have to fight a grizzly bear or an alligator. Just living life on the edge, my friend. And that's what I tell people. Like, if you're going to live like that, it's the same thing. Like, you don't need to take your car in to get the oil changed or rotate the tires. You need to literally just live life on the edge. Don't do anything. And then when it starts smoking or rattling or the brakes don't work, that's when we're going to go get it checked. And then when we get a big bill, because all of the work that needs to be done to fix it, and it's going to take possibly a long time that we're going to now have to leave our car at the shop, then, hey, we'll learn that that's the same thing as getting admitted to a hospital. We now have waited until your engine light came on, your heart has started having problems, your brain started having problems, your kidneys started having problems, and then you go to the mechanic, aka the hospital. And the hospital says you need to leave your car with us, and guess what? You're the car. So now you're in the hospital getting fixed. And then when they give you that bill on the back end and you're over there upset of why is it so expensive? Well, you did none of the maintenance. You did none of the routine stuff that they recommend and we constantly tell you to do over and over again. So that's one of the things that I think people miss. They miss the idea of going to the doctor before something's wrong. I literally had a patient yesterday in my office who's a very healthy patient. Healthy, works out all the time. I mean, possibly 6-7 days out of the week, my friend. And still has high blood pressure and still has high cholesterol. And it's not because he's trying to do that. But sometimes we don't have control over everything. We have genetic components, we have social components, have environmental components, and we don't know what we don't know. So he came to me after seeing me last year. He was so healthy. I said, come back and see me in a year. If anything comes up, let me know. And we've communicated every now and again for small things, acute things. But from a health and wellness standpoint, healthy guy works out. I was like, hey, see me in a year. So now that he's seen me and we now have identified from a routine checkup, just routine, no problems, routine. We've identified problems. We now have a way to correct those things before they become catastrophic. And he's in the hospital. And his words to me, I'm glad you told me to come in. I didn't even think about it. It had been so long and I've been basically so busy. I know I'm glad that you kept up with it because I know it could have gotten out of control. And now that you've held me accountable, I can do better. And that's the idea of going and engaging in care before something happens. It's the accountability. It's knowing when there's a problem early on so we can correct the problem before it becomes a chronic issue. And then if it does happen to become a chronic issue, we still can stop it from progressing. So if people will learn that from a prevention standpoint of engaging in care before things happen and not waiting until you're sick or on death's door or until you think it's bad enough, that's when I think we're going to have, again, better outcomes and less healthcare disparities.
So what are the main things that you're looking for from a preventative standpoint? Say somebody pops in on their first visit, I'm all healthy, or so I might think. What are the main things that you're going to be checking?
Yeah. So the main thing that I think a lot of people are surprised about is we usually start with simple things, vitals. And the vitals are things like your blood pressure, your height, your weight, your pulse, your oxygen level, and your breathing patterns. Then, of course, the next thing is what we call a history. History is basically just getting information from you about your lifestyle and things that may or may not cause problems. Those two things alone usually give us enough information to know, do we need to do some treatment, more evaluation, or you're going to be more than likely on the healthier side. From there, we can do lab work. And with the lab work, that allows us to then determine if some of the things we're concerned about are valid or they're not. And then we talk treatment. So in my first visit, depending on how bad or how good someone is, I may not give them any treatment. I may say, hey, we got to get some labs, and once the labs come back, we'll make some decisions. In some instances, I automatically know you're going to need medicine on the first visit because your stuff is that bad. So I will say it comes down to a case-by-case, thorough evaluation for each person. It's not as cookie cutter. Again, we do analogies, but it's not as cookie cutter as, hey, you drive an Oldsmobile, so everybody gets the same brake job. No, it's not like that. In healthcare, the analogy stops at when you come in, we're going to now give you the custom treatment, and your plan should be your plan. It's not the plan that your brother got, your sister got, your mother got. It's going to be yours because we want to get it right for you. And if we get it right for you, you're going to feel better. And if you feel better, you're more likely to tell your friends and family to go do the same because now that you're feeling better, they should do the same as well. And I've had that happen on multiple occasions in my practice currently. In the last few months, I've had a patient who literally came in, his anxiety level on a scale of 0 to 21 was 21. He literally had the worst score you could have. And his words to me was, I didn't even know anxiety was a thing that I could have because I just thought it was normal. I thought I was supposed to feel like this. From that conversation and treatment and doing things the way that we recommended specifically for him, he then told me my brother got better because I talked to him about my treatment and what I was going through. And he then went and got evaluated by a different doctor, but he's now in treatment. So my health affected his health, which now we're both doing much better. And can you imagine what happens to men who don't get treated for mental health issues in the right amount of time? It doesn't end well. So that conversation of getting into care and being proactive and not waiting until you feel like something's wrong is paramount, my friend. And I think that's something that we often need to talk about. When you come in, you're getting a custom evaluation so we can get your treatment right from the diagnosis for you and then go from there.
Yeah, that's a good point. I mean, from the musculoskeletal perspective, we see that all the time, right? If something is hurting that bad, especially if you talk about the male side of it, I mean, a lot of guys stereotypically wait until the absolute last moment. So we're getting the call when the person can't walk. Generally, what I ask is, what made you make this appointment? And most of the time, it's going to be that they cannot do the number one thing that they need to do. They can't work, or they cannot do whatever activity they love, from playing sports to stuff like that. And even the sports side is actually a little bit better because that means at least they're asking their body to do much higher demand. So if that's injured and they can't do that, they still have a good baseline function to where they can go to work, they can do things. But a lot of times it's like, I can't work. I can't live my life. I can't be there to take care of my children. And once a tissue has gotten to the point where it's hurting that bad to where you cannot do those things, then that means that that tissue is going to have experienced like damage over a more prolonged period of time. You know, if you think about how far it has to go for it to hit that point, well, most of the time we're dealing with legitimate tissue damage at this point. That's going to be much harder for us to get feeling better, as opposed to early on, you might see some. I see it in bikers or just people are sitting so much. You just test the hip range of motion and you find that it's a little stiff. Well, all of a sudden, like, all right, hey, do these stretches. We caught this before it's causing you any issues. The person starts stretching their hip a little bit, and all of a sudden, that hip keeps moving, and they improve the range of motion, or at least to a point that's needed. Instead, if they ignore that hip that's not moving very well, well, now you start to get arthritic and degenerative changes in that joint. All of a sudden, instead of us just improving the muscle and the ligament flexibility with stretching, all of a sudden now you're experiencing something that is now a bony change because the body has adapted that position. Now you have arthritis, now you have hip impingement, you have these things that maybe some basic stretches. And sometimes I would see that in like a biker or someone like that who's sitting all the time. It's just, they don't know what they don't know. They don't know that their hip needs to move in a certain direction. And it started to progress over time. And so the same thing, it's much more visible in your joints, but the same thing is happening in your organs because nobody can really see what's happening inside their heart or inside their vessels or things like that, which makes a big difference. Are there any preventative tests or timelines that people need to get checked for different things?
I think for the standard general, not knowing a lot about a person, when should they engage in care? Again, I'd say once you're an adult, starting at age 18, literally an adult, by, for the most part, legal standards, is going into getting an evaluation at least once a year. I think that's a simple thing for any adult to do, male or female. And it doesn't mean you're going to have a lot of treatment recommendations, but it allows us to get a baseline on you. Now, if you say, well, look, I don't want to do that. I'm probably going to college or doing something where I'm not going to really have as many health concerns. I'm going to wait until after. Okay, so be it. So let's say we're now 21, 22 years old, something like that. Again, same conversation, coming in, getting checked at least once a year is simple. When we start going into diagnostics, blood pressure is going to get checked at every visit, so that allows us to identify blood pressure issues early on. And then once you're in your 20s, starting to get into mid to late 20s, we may start doing lab work to check for things like cholesterol, depending on guidelines, body habitus, and then, of course, family history. So if those are identified as problems, we're talking treatment in your 20s, if not potentially late 20s. As you get into the 30s, we're looking for the same things, but then we start adding on more stuff. So screening for things like diabetes, things for musculoskeletal problems that a person may have, stress, anxiety, depression, all those screeners start to get added in. And if we're not already doing them, we're going to probably do more of them. I've said that wrong. If we're doing them, we may do more of them where we're asking more involved questions that are more pertinent to your lifestyle and what's going on. And then, of course, going through the 30s, that stays the same for a while. And then when we hit the 40s, it's when we start looking for a lot of our cancer screenings. So things like prostate cancer, breast cancer, and then depending on a person and their family history, even sometimes colon cancer. Lung cancer can be in that as well. So all those things start to get added on the older we get. But it doesn't mean you can't have screenings for those things when you're younger. I've had some patients, and unfortunately some classmates, pass away from being diagnosed with breast cancer. And they were in their 20s, if not 30s. And it's unfortunate because according to guidelines, you may not screen them until they get to 40. But if they're in care and they're getting talked to and having discussions with about checking these areas, they may be more willing to do that and catch those things early so we can get them treated early and that person doesn't have those long-term catastrophic events. So screening, and more screening is important. And it's not because we are bored and we have nothing to do. I told my patient yesterday, I know you don't like coming here and hear me tell you all the stuff we need to do. I know you don't like it because it may seem overwhelming because you just have a lot of stuff getting thrown at you. But the good news is we're catching your problems early because we screened you early. And that now allows you to get ahead of it. And if that doesn't make you feel better right now, it will in the future. So the screening may not be fun. You may not want to go sit in the doctor and hear me talk to you about your cholesterol and your diet. and your family history and the cancer screenings that you need to do. But if we catch it early and you then have the diagnosis and the treatment that allows you to live longer, I think you're going to feel way better than if we didn't and you quote unquote just did it when you felt bad.
Yeah, that's a really great point. I think something that a lot of people don't fully process or we self kind of explain is that a lot of habits and lifestyle things are also, they change the odds of things by percentage, right? So smoking, I think it's what smoking causes a 7-fold increase in lung cancer, but that doesn't mean that without smoking, there's a 0% chance of lung cancer. It's just because you eat relatively healthy doesn't mean that there's a 0% chance of heart issues or cholesterol issues. These things are, you're doing your best in creating the best odds of healthy and wellness, but we still need to make sure we do the fundamental screening to make sure that something's not happening, that we're evaluating blood work, that we're evaluating these things. What is one wellness trend you think is overrated? And then one you think that is truly valuable?
I'm going to say overrated in a very asterisk caveat kind of way is over supplementation, right? Supplements are great when used correctly. And I know you know this. I know you have patients who you probably use supplements with, but you don't say, well, look, if one supplement is great, then 50 of them must be much better. And let's go ahead and give you a cabinet full of supplements. I think people want to supplement their way out of bad habits, right? Well, my pressure is high. I eat like trash. I don't want to work out, and I definitely don't want to go to the doctor. So let me take 5 supplements, and it's magically going to make me feel better, and somehow my pressure is going to fix itself. Or I don't sleep at all. I don't actually mind the idea that I'm exhausted, but I'm going to take this supplement, and it's going to make my sleep better. And it's like, that's where I have a problem because you're being sold the dream, as what I tell people in the clinic. I can sell you anything as long as you're buying. I can sell you whatever you want me to tell you as long as you're buying it. If I tell you this bottle of water is going to make you live forever, and if you think it will, you're going to probably pay for it. So if you're on social media looking to find a way to sleep better and an ad pops up that says this helps you with sleep, you're probably going to buy it because you're looking for an answer. But most of the time, people don't want to look in the mirror. And that's where the answer is. You're the problem. It's not a magical supplement that you're missing or I'm deficient in this 15 vitamins and minerals. It's because you eat badly. You don't want to listen. You don't want to sleep. And you think you're going to somehow live forever with these bad habits. That's the reason why I think that is overhyped. So getting 20 supplements, it may be great for the right person. I'm not going to say who that person is because I haven't met them yet. I do have some health conscious friends, very health conscious, like work out 7 days a week, and they take a ton of supplements. But they also know what they're doing outside of the supplements. They work out, they eat right, they go to sleep, they go on vacation, they're around people they love, and it makes them, in my opinion, healthier that supplements are not being overutilized. They're being utilized to maximize things they're trying to achieve. But for the average person, and I say this from a place of love, and when I say love, it's sarcasm galore. You all are literally hurting my spirit when you tell me you have bought this supplement from so-and-so on this social media site and have done no research on the supplement or the person selling it. This person has a great social media campaign and they have sold you the dream. And then you come to me and want me to vet the supplement. And I'm like, I don't even know why I have homework because your friend told you to buy this supplement. Like, and again, you can list a lot of them. My favorite, where I laughed a lot, was the magnesium craze, where people were putting magnesium on their feet in their socks because it helped them sleep better. And I'm like, who came up with this? I want to bottle this person's energy and their sales capacity because that is genius to make people think that if I spray magnesium on my feet, I'm going to sleep better. Like, I need to be that good at selling stuff, right? That's what I need to learn in life because then I don't have to work as hard. But that's the part that people just don't realize. How about you just look at how bad you sleep? And then maybe that's the place where we spend money. Making your bed more comfortable, making your room more quiet and more accessible for you to feel like you want to go and get in the bed rather than sit on the sofa because the sofa's more comfortable. Doing that may allow you not to spend money on magnesium foot supplements. I don't know. You tell me, Dr. Chris.
Yeah, no, I mean, I agree with you. The asterisk and all of it, I think it's gotten out of control. I think most of the time people probably have the supplements for the 1 month where they're feeling healthy. and then it sits there being unused. That's why a lot of the research is hard, because a lot of people don't continue to even use the supplements when they're not on their habits, right? It's like all of a sudden it's like, it's a thing. Oh, I worked out, so let me have my vitamin today. But then, the next week you don't have any of them because you were off your routine. So the key is consistency. And I agree with you big time about the bad habits. The new phase that's been driving me mad is, everybody's talking about the new research that came out on creatine, where the 20 grams creatine per day is supposed to help with exhaustion or sleep deprivation.
I thought it was cognition, but I wouldn't be surprised at exhaustion. Yeah.
Well, so it was cognition tested under sleep deprived conditions.
Gotcha.
Is what it is. So they did some cognitive testing in sleep deprived people on 20 grams. So everybody now is like, oh my God, take your 20 grams of creatine for sleep deprivation. And I just see, all of a sudden people are going to start, there was good research that came out that we just needed 5 grams per day for good muscular benefits, and it may have cognition. There's some stuff coming out that maybe you might need a little bit more than 5 because the muscle uses the 5, but you can also get it from different meats and stuff like that, and then you per body weight. But all of a sudden now it's got to go all the way to the other extreme, where all of a sudden now they have to be talking about taking the 20 grams, which now we are talking about, different concerns from you start chronically taking 20 grams of creatine per day every day because you're not sleeping, and all of a sudden, it's just the way we take things, we take them way too far. And creatine is a great supplement, so I don't want this to come off. It's just funny that it went from the 5 grams per day to all of a sudden now everybody's got to talk about the 20 grams per day. And I think it applies to all the supplements. And that doesn't even get me going into the social media stuff and a lot of these companies that just decide one day that they also want to sell and make a supplement, even though there's no verification process into the product at all. And the funny and kind of sad part of this is that and this is where I have a lot of trouble, because I am a fan of certain supplements, or at least trying them out in a safe manner for certain issues. The companies a lot of times that love harping on and talking about the low level of verification in the supplement process are frequently the ones that have no verification in the supplement process, if that makes sense. So it's like you see the social media company, they're like, do you even know what you're taking for GNC? And it's like the odds are that GNC product might actually have been tested by consumer labs or someone, but this random social media supplement company hasn't.
Because they have a bigger bank account than GNC, I'm sure. Right? Hence why they're advertising on this random social media page that you probably never heard of.
And don't get me wrong, I'm not saying that all GNC supplements are 100% validated or something like that, but generally what you can do is you can get I have a consumer labs account, and what I do is if there's a specific supplement, I go through the consumer labs where they've actually tested these products. Or I recommend, if something is USP certified, that means that it's been independently tested by them, or NSF certified. Those are the big things to look for in supplement companies, to make sure that the product that they're providing is actually good quality and present, because a lot of times the supplements don't even have what they're advocating that they have, or they have a different form of the product that they're stating. And I guess this stuff does get tough, because sometimes you have the more local things are harder for them to be independently tested, and you get into all those dynamics. But I think
I'm going to jump in and say one thing to help potentially your point, and I think you're cooking, my friend, so kudos to you. But I think the other part is doing your own research, right? Yeah. And if you can't, go to someone who you feel is going to give you an honest shake. They're not selling you anything. They're telling you the pros, cons, and giving you advice. From there, you can go purchase or not. And I think that's the issue. People hear something and they run with it based on what they hear. And the people they're listening to are often not the most intelligent. They're probably the most charismatic. And when I say that, it's hard for people to wrap their head around, how can someone with a lot of charisma not be that smart? Look at the politicians. That should tell you all you need to know. Whatever your political leaning is, we got a lot of them. They can definitely give you a sound bite. They can deliver a speech, but they can't do very basic things. And those very basic things are things like tell the truth and possibly give you honest data. So if you find people who can do that, I think that's going to help you in your supplement journey. And that's hard to do because that whole industry is riddled with a bunch of people who are just trying to make a profit.
Yeah, and some of it is also complicated because you're trying to find a way to help. Because as you've said previously, that to an extent, medicine is trying to, the reality is medicine, you're trying to keep people alive a lot of the time. And so most of the money, most of the resources are going towards that, which is how I would prefer things to be. We need to keep people alive. But from the flip side, within the supplement realm, you have a lot of these topics that are in the weeds that a lot of them are very like, probably lifestyle is playing a big role, but then there's just a lot that, I'm sorry, I don't think we as humans know everything about everything yet. So there's new supplements coming out. There's new information coming out. It's just a wild and crazy world where, so if you're somebody who sits there and is like, I want to do everything I can to help out with this issue, what are all the things to try? And to an extent, there's some balance of if it's safe and it's not going to cause harm and you can afford it, then okay, maybe we do try this. And so the way I frame things a lot is, and of course, I'm not recommending supplements for anything out of my scope. So I'm not going to be talking about supplementation for the heart, so to speak. But like from a musculoskeletal standpoint, maybe I'll talk about collagen, which the research on collagen really isn't great. Like, I'll be honest, maybe there's some element of if you supplement with collagen 15 to 20 minutes before you do heavy eccentric loading for the tricep tendon, maybe with a little vitamin C, maybe there's some increased collagen deposition in the tendon, which could benefit it. Okay, well, I guess that's kind of situational for you as a patient if you want to try that. You know what I mean? And where does that rank on the prioritization checklist of what you should be doing? Well, the most important thing is the loading of the tendon. So if you're taking collagen and you're not loading the tendon, if you're not working out, but you're taking protein supplements, like we're missing the boat here. You know what I mean? We have to do the top priority thing. If we're staying up all night scrolling, but we're taking melatonin or whatever supplement to help us sleep, then we're missing the boat. So a lot of times I think that's key is like what supplements are priority? Well, then of course testing, if we're vitamin D deficient, we should probably be taking vitamin D, but also trying to go out in the sun because the sun is a very, healthy form of vitamin D and it has a lot of other benefits. So, that's, I guess that was a large rant on that.
But it's a spot on rant. It makes sense though. As you said, it's very situational and it's very specific to different people when those people are going to do what? Research, listen, and have advice from someone who knows what they're talking about. Someone who literally does this daily, right? And last I checked, I don't think you stop being a chiropractor for 6 months out of the year to go find yourself, record a bunch of videos, and sell a bunch of products, and then you come back and become a chiropractor. Not yet anyway. So until that happens, you're probably working here daily, if not more often than not. So if that's the case, you're probably a good person to listen to about these things compared to the so-and-so on social media who you don't know anything about and you've never even tried to look them up off of social media. And when I say look them up, it's not, I went to the website where they're selling the supplement and read the bio. No. We're talking about where you literally know this person is doing the work and the research beyond what they're selling. And if you can figure that out, verify that person seems reputable, trying it, go ahead. I don't have any harps about it. But most people don't do that. Most people see one story on one news article, news outlet, and social media page, and they go buy stuff. And then they come to us and wonder why it doesn't work, or did I waste my money? And it's hard for me to tell them, no, you did not, or even tell them if it's accurate, because I don't have all the data either. I'm not sitting here looking up 800 supplements a day. So I now have to go and try to do research that you didn't do to tell you an answer that you want to know. And then even after I tell you, you're not going to listen anyway. So it's just basically a vicious cycle. So all that being said, to answer the question that we went completely over and through, supplements in my mind is probably the biggest waste, if not facade in health. That is one of the things that just gets out of pocket and we need to do better there.
Absolutely. What is one you thought, the second part of the question that we went off the rails on? What is one you think is truly valuable?
From a health standpoint, and again, I don't call it a social media craze. I think it's one of those things where people don't realize the power of being in the right community, in the right setting. That actually, when you see people who are traveling a lot and they're seemingly happier and healthier, I know some of them are doing it for likes and clicks, but let's take it out of traveling. If you just see a video of somebody who's meeting up with friends, once a week laughing. And eventually you say, man, they've on to something. They really and truthfully look happier than I do. You probably are going to put your phone down and go find some people to start laughing with, right? You watch a lot of people who have a lot of authentic interactions on their social media pages or in their lives. You tend to start seeing those people be healthier and happier. So I think the craze that I would say is not overrated is finding your tribe, finding your community, finding your village. If you can do that and hang out with those people more often, you potentially go further in life. And again, you live longer, right? So when you find that group of people that make you feel better and also help you when you're down, promote you, what's the word I'm looking for? Motivate you. They promote your ideas. They help you see your dreams, help you reach your dreams and see the goals you're trying to get to and help you get there. Those are the people you want to be around more often, right? It's unfortunate because we've all had people in our lives that we don't realize that they're dead weight, like they're just anchors, and they just really and truthfully don't do anything for you than make you feel some kind of way other than happy. And those people are the people we need to stay away from. And again, they might be in your family, they might be in your neighborhood, they might be in your religious or faith-based organization. As much as you don't want to be rude or mean, you need to distance yourself from those people and be around those people who do the opposite. Now, I'm not saying be around enablers. That's a whole different conversation. You don't want a bunch of yes people. You don't want people around you that just tell you everything you want to hear and basically brown nose. Those are the worst, probably more problematic than the other people who are more toxic. They're probably one and the same. But you got to find that right group. And when you find them, you feel better, right? I bring that full circle to say that's how I felt when I walked into my first direct primary care conference. Like when I came into the room and started hearing how the people were and how they were interacting and how they were laughing and joking and talking about how they enjoyed practicing medicine, I was like, oh, where do I sign up? Like they had me at hello, as the statement goes, because to me, that's the way it should be. You should feel that way when you're practicing medicine. And that's how I knew I found my group. Now, that's more professional. There's social, there's business. Those are all different settings where you can find a different group. But that's the thing I think will be a phase or a craze or whatever that is going to hopefully be long-standing.
Very cool. Yeah, I think that's like finding people that give you energy, finding moments, finding environments, finding activities. One of the biggest things is learning how to say no to things that drain you as well, that, pertain to mental health. That I guess that taps into the next question of what role do you think mental health plays in physical wellness or in overall health?
I think it's a balancing act from both sides. You have to have really good mental health to achieve the best state of physical health. And you probably need to have pretty good physical health to achieve the best state of mental health. Now, it doesn't mean you have to be, for lack of a better term, able-bodied to be able to have both. No. You can still not necessarily have all functioning fill in the blank from a physical standpoint and still be extremely happy. You can be the opposite. You can have every ligament, joint, everything perfectly physically aligned and anatomical and working the way you want and be miserable. So I think it comes down to working on both. It's not just getting out of bed and hoping those things are going to be better, hoping they're going to stay around because you just got it like that. I use the statement often in my practice: if you don't use it, you lose it. So if you're not using your mental health to try to achieve better mental health, you're going to have poor mental health. If you're not using your physical health to try to achieve more physical health, you're going to have poor physical health. So if you're sitting on the sofa and wondering why your knees hurt all the time, your back hurts all the time, and your joints are cracking and all that, it's probably because you're not doing a whole lot. And if you're sitting at home and you're oftentimes wondering why you feel so sad or so anxious, and you're not actively trying to get treatment for those things to address them, it's no wonder they're getting worse. And a lot of times, if you don't know, that's why we tell you to get into care. That's why we tell you to come see us, myself, Dr. Chris, and all of these other amazing healthcare professionals on Wellness Academy, because we actively work to help you feel better and don't have to do it all by yourself. Now, if you just want to do it by yourself, okay, fine. But make sure you're doing it actively, not a flash in the pan. You saw a commercial, you thought it was a good idea to do this one thing one time, and then you never go back and do it again. If you're consistently working on mental health, you're going to have better mental health. You're consistently working on physical health, you're going to have better physical health, and vice versa. Or conversely, you're going to have one and the other start to go hand in hand.
Yeah, I love the way you put that it's, and I kind of hope that we do that going forwards, because I think that the mental health world is, I mean, it's relatively new, you know, so on the grand scale, of course. And so as it's going, I think we're going through like different ebbs and flows as we learn about it. But I hope that as it goes, I think we've made major strides in it becoming much more mainstream, that we're acknowledging it. You know, you're having professional athletes like talking about it and what they're going through. And I think that's awesome. And I hope that that continues. And I hope that it's something that people start to think of from also, I know the optimized movement is getting absolutely crazy, but to an extent, like, how can I optimize how I feel?
Hmm.
How can I optimize how can I make it so that, like, not just looking at it like, oh, looking at it as a negative that my mental health can hold me back from things, but how can I start to improve it so that it helps me perform? And to circle back to one of the most important things for your mental health, the number one habit was sleep, was big for mental health as well. But I like that. I like the way you put that. You need to nurse it and continue to take care of it.
Yeah. Be an active participant in it. Yeah, I think is the best way I can articulate
Yes.
it. If you're actively participating in those things, you're going to get better results than you're being a passive participant.
Yeah. So as moving forward, we've gotten through like barely any of the questions that I have here, but we're going to start to go into a couple personal ones before we sign off. If you weren't a doctor, what career do you think you'd be doing?
I think the easiest one would be a DJ, right? I love music. I'm actually a amateur, extremely amateur DJ where I actually have turntables, a mixer, speakers, microphones, all in my house. And that is my relief of stress, right? Remember how we talked about finding things that help you de-stress and decompress? That is my therapy, right? So on a good day, if I'm having a really, really bad time, I'll just go and turn on the turntables and start mixing and record the mixes and obviously play them back and stuff like that. But that is what I think would be the lowest hanging fruit for myself. Like I could see myself doing this because I enjoy it and it doesn't feel like work. Now, I don't know how long that would last because I'd probably be a very crappy DJ because I don't like being up too late. I'm the 5 o'clock to 5:55 DJ. Like, okay, gotta go. I need to get this sleep.
DJing at the nursing home.
There you go. There you go. They need jams too, my friend. That's all I'm saying.
What do you mind sharing with everybody the DJ name?
Oh, yeah, it's easy. So it's DJ Supreme Soul, and we are on. The name of the website is Mixcloud. Mixcloud has a lot of DJs on it, so great website. So if you are looking for random DJs to listen to and mixes that sometimes are free, you can do that. Especially if you find a DJ you like. I will say, be very careful because some of those mixes are not safe for work. Okay, they are profane and profaned a lot. However, they're really good. So, in my mind, if you are looking for that, you can definitely get that and listen to some of the very old mixes, which you could tell again that amateur title. I wear it very well, and then obviously as time goes on, I could start to get better. You can tell that there's a difference in quality. So, but yes, DJ, that would be it.
That's amazing. What's your favorite music to DJ
Believe
or
it,
to mix?
it's soul and funk music. I like upbeat music. I like music that makes you get up and move and makes you feel good. So I do a series. I haven't done it in a while, but there's a series on the platform Mixcloud that I do for old mixes, and it's called the Shakedown series. I think we have 7 parts. Each mix is about an hour long. So about 7 hours of upbeat, funky music of getting you hopefully to move and dance. And I believe those are some of my favorite of the series that I created from the mixes and the themes that we do.
So, what is the best advice that you have ever received?
I get a lot of advice, sometimes unsolicited. Let's start there. Some that you don't need to listen to. I think the biggest and the best, at least for now in this moment, is be true to yourself. Don't let anyone put you in a box and make you think that the stuff that you're doing has to be that and that alone. I get told all the time, oh, you're just a doctor, right? And that's my favorite. And I always laugh and I'm like, I guess so. In your mind, that's what I am. So that's what I am. But for myself, I've been so much more than that because I know I have a lot of interests, right? So if I talk to one person, oh, you're a DJ. Okay, great. They may never know that I'm a physician. Some people know that I'm a physician, never know I'm a DJ. Some people don't know that I have a passion for business and have multiple businesses, right? And we talk about this all the time offline. We're constantly talking about business stuff back and forth to where you're one of my good friends of business ideas, where I have an idea, I tell you, and you have an idea, you tell me. So those are the things that I think from an advice standpoint, people need to hear and not just hear it, but live it and believe it, that you don't have to be one thing. You don't have to just be a good dad or a good sibling or spouse. You can be a good spouse and a good friend and somebody who's good at work. And you don't have to just be one thing. You don't have to go to work, give your all in that job, and then come home and be a crappy spouse, right? Like, so let's be more and be authentic to what that is. You may be a spouse that hasn't told your loved one that you really want to do X. Hey, I really want to play the guitar. I don't know why. I just want to try it. Can you support me in playing the guitar? And all of a sudden, you're a guitar player and you are much happier because now you get to play the guitar. And before, you just went to work and was miserable. So why not do more of that? Right. So that's why I say you can basically be true to yourself and the rest is going to follow.
That's awesome. I think, I guess one thing I noticed with you too is how you talked about like surrounding yourself with people that give you energy. And I think that's one of the pieces of advice that I really like. And I think that's one that I noticed from you is like you always are providing and building people up, giving them energy to be themselves and to go conquer whatever they want to conquer. And so I think that's really cool. So we've gotten to about an hour and 10. You telling people where they could find you?
Absolutely. So I am in a lot of places digitally mostly. Otherwise, I'm probably in Baton Rouge most of the time. Hence why you and I are always getting along because we usually running into each other doing random stuff. But socially and digitally, I am at my clinic website, www.byja.org for our clinic, Byja Clinic, which is a direct primary care practice in Baton Rouge. Our nonprofit arm of that practice is the Byja Charitable Alliance, and that's www.byjaca.org. If you'd like to make a tax deductible donation to help people get access to medical care who otherwise may not be able to access equitable and accessible and affordable health care, feel free to give us a shout and a look at that website. Social media, Byja Clinic. We're on LinkedIn. We're on Facebook. We're on Instagram. And of course, you already know my DJ handle, so you can find me on there if you really want to.
Do you mind shouting out quick your for any students or any mentees that are looking for mentorship?
Absolutely. So we also have a nonprofit called Comprehensive Medical Mentoring Program, or CMMP. And with the Comprehensive Medical Mentoring Program, it is our nonprofit organization focused on getting more minorities into the medical field. So if a person is interested in potentially pursuing medical school and other medical pursuits, we are potentially the place for you. And I say potentially because we basically want you to work, because we want you to love the idea of going into medicine. And it's not for the weak of heart. Dr. Chris can tell you this. I can tell you this. But if you're willing to do the work, we have a lot of opportunities where we try to help people with things like clinical shadowing programs for people going to medical school. There's a pre-med boot camp program that we run trying to get people ready to apply to medical school. And the best part of everything, Dr. Chris, for this organization, for the students, everything's free. So they don't pay for anything. Are blessed to have a lot of great donors and a lot of people we've worked with that have given to this organization to help us reach those students, give them those tools so they don't quit and they keep going and eventually become doctor fill in the blank. So we really love it. And that's definitely something you can find us. The website for that is www.cmmpmed.org. So cmmpmed.org. And again, Comprehensive Medical Mentoring Program.
So how do you find time to sleep with all this stuff?
Well, I'm going to sleep right now, right after we jump off, right after we disconnect. I'm falling asleep right here at the table.
So for everyone here, this is Dr. Byron Jasper from the Byja Clinic. There was a lot of topics we weren't able to get through, so clearly we're going to have you on multiple times next year. So if there's anybody still, feel free. I know we did the Q&A, but if there's any questions you want from Dr. Jasper, of course, reach out to him via the ways he said. But also, I'd love to hear your feedback on our episode and let me know if there's any topics that you would like for me to ask him in the future. And I will certainly be doing that because he's definitely going to be back. He's a wealth of knowledge, and it's really endless, the things we can talk about, because there's a bunch of things we didn't even get into. But it was a ton of fun having you, Doc.
Thank you. And this man is a humble gentleman, so I'm going to do it for him. If you have listened this far, and we do this on Byja Radio, so in case you haven't done this, I'm doing it for you, and I'm going to give you this segue. If you have listened this far, number one, you're a real one. We really appreciate you. Let's start there, okay? So we thank you for giving us your ears and your time. But number two, like, subscribe, share, follow, rate, do all those things to make this person the next best social media, regular media, global phenomenon, because he's doing the work to give you this education and bring people on like myself. So Dr. Chris is awesome, and let him know he's awesome, because just doing this and saying, oh, I listened, this is great, and jumping off, number one, that's just really not fun. That's not cool, right? I don't think that's fine. If I came to your house and watched your TV and didn't tell you thank you, you would feel some kind of way. So Dr. Chris feels it. He actually tells me this all the time. So we're going to get him more ratings by making sure you like, subscribe, rate, share, comment, and follow. And I believe I've said enough, Dr. Chris, because at this point you're laughing. So I knew I was going to go far enough to get you to crack a smile, because you were being real stoic. And I was like, no, we got to break him at this point.
Can't end with that, right?
Exactly.
As soon as I get the camera,
Yeah,
No,
exactly.
I appreciate the support, of course. And honestly, I couldn't emphasize enough what you said is if somebody's still, listening through, I really appreciate everybody's support. It's really been a ton of fun, and I want to continue to do this because I want to continue to provide people in the Baton Rouge or other areas with access to these awesome minds that we have, like these experts in these fields, like Dr. Jasper. We had Dr. Vincent Williams, we had Kylie on here, we had Dr. John. We've had a lot of great guests, and I want to continue to do that because I think it's really important for us to hear what local and what experts are saying that aren't necessarily in the national spotlight. And so providing you with context and providing you from information from people who are truly boots on the ground, treating patients, working with people. And I think that's really important. So thank you, Doc, for the support and everything. And thank you for all the information. You rock.
Absolutely. Thank you.
Cheers.